2-minute doc. In today's episode of Simply Pathology, we're going to see about multiple myeloma. Multiple myeloma is a plasma cell neoplasm. It arises from abnormal excessive proliferation of plasma cells. We all know that plasma cells are derived from B lymphocytes. The malignant cells of multiple myeloma results in excess of bone destruction. This can be seen in X-rays as punched out defects. As you can see in this X-ray, you can see punched out defects on the X-ray of skull. These are usually 1 to 4 cm in size. The commonly involved bones are vertebrae, vertebral column, followed by ribs and skull. Pelvis, femur, clavicle, and scapula can also be involved. This also results in hypercalcemia. The excess bone destruction results in hypercalcemia, which can lead to neurological manifestations, constipation, and renal dysfunction. There is excessive production of proteins known as BENCE proteins, which are nothing but light chains of immunoglobulins, and these BENCE proteins are toxic to the renal tubular epithelial cells, so they cause renal injury, and finally they predispose the patient to develop renal failure. Bone marrow biopsy helps in diagnosis of multiple myeloma. In bone marrow biopsy, we can see that more than 30% of the cells are plasma cells. And apart from the plasma cells, we can see certain plasma cell variants like flame cells and mott cells. Flame cells are plasma cell variants with fiery red cytoplasm, and mott cells are plasma cell variants which has grape-like clusters in the cytoplasm. Apart from this, you can see anemia, leukopenia, and thrombocytopenia. So all the cell lines are decreased in patients with multiple myeloma. M protein, also called as myeloma protein, is produced in excess in multiple myeloma, and this M protein is one of the reasons for rouleau formation in patients with multiple myeloma, where the RBCs get stacked up in a linear fashion. This M protein can be diagnosed by electrophoresis. M protein is composed of immunoglobulin G in majority of patients. Multiple myeloma patients are more prone to develop infections, and in fact that is one of the most common cause of death in patients with multiple myeloma. That is because of decreased humoral immunity. 2-minute doc is part of the YouTube channel MedVidsMadeSimple. If you like this video, please make sure to like, share, and subscribe to 2-minute doc for more short and crisp 2-minute videos. Please read the description of this video to know how you can support our channel without spending even a single dollar. You can also support our channel directly by donating on Patreon. The link is in the description. Thank you for watching. See you tomorrow in my next video.